Hi, Dr. Jones.
Hi, Megan. How was your weekend?
Good. I saw that Mrs. McClinley, the patient we saw last week with the cough, is back in again. I hope she's feeling better.
Yeah, there's one little problem. You know how I had you do some teaching to her about the inhaler?
Yes.
Well, when you wrote down to take it as often as needed, she used it a lot, like every 20 minutes, and she ended up in the emergency room. She was pretty mad, so I think probably I should see her by myself today.
Oh.
Giving feedback in a constructive manner is one of the most difficult skills for a preceptor. Unfortunately, lack of feedback is also the most common complaint that we hear from our students. As primary care physicians, we are naturally inclined toward empathy. We want our students to like us, to look forward to working with us, and to feel positive about primary care. It may be difficult for us to switch gears from friend and mentor to evaluator and supervisor. To help facilitate this process, students are responsible for completing a mid-rotation feedback form, and they should be approaching you soon to discuss how they are doing. Dr. Craig Jurdy has created a model for giving constructive feedback. This includes preparation, observe performance, plan the issues, find a good time and place. Ask, is this a convenient time for me to give you feedback? Let's talk about the situation. How do you think it went? Listen to their self-assessment. You did a great job on give specific examples of strengths. And you could do a better job on cite their weaknesses. Avoid using but. Next time, I would like you to try, give helpful suggestions for how to improve their performance. Could you summarize the main ideas from what we talked about? Check for their understanding. Frequently, students will only hear the bad side of what you had to say. Let's meet again. Keep working on. Add closure to the session. Come up with a plan for how you're going to monitor. Let's see how this might look.
Hi, Dr. Jones.
Good morning, Megan. How was your weekend?
It was great. I saw that Mrs. McClinley's back in here. You know, that patient we had with a cough last week? I hope she's doing better.
Yeah, Megan, would this be a good time for me to give you some feedback?
Sure.
Okay. Well, I'd like to talk about the albuterol teaching that you did with Mrs. McKinley last week. How did it go?
Fine. You know, I actually hadn't ever done that before, but I found this really great website to use, and it showed her how to use the inhaler, and then I had her demonstrate it back to me, and she could do it okay. Was there a problem?
Well, it sounds like you did a great job with the actual inhaler teaching, and it's really good to have them demonstrate back to you. Another important aspect of using albuterol is the frequency of use. We want to be careful not to use it more frequently than every 4 hours. Unfortunately, when you told Mrs. McKinley to use it as often as needed, she took that to mean every 20 minutes. She ended up in the emergency room with palpitations. Now, she did okay after a period of observation, but she was a little mad. Next time, I want you to really check with me if you're unsure about instructions.
Okay.
Now, I'm sorry to be the bearer of bad news, but I just want to check with you to make sure what you've heard from this feedback.
Well, I screwed up big time.
Well, you did a nice job with the inhaler teaching. You found a good resource, and you really explained it in a way that she could understand. And you should have checked with me about the instructions. Is that clear?
Yes, I should have checked with you about the inhaler teaching. And if I'm not sure about something, I'll check in with you first.
Great. I'm going to have you keep working on patient education, and I'll give you a little bit of feedback again in another week or two.
Okay.
Another strategy that some preceptors have found useful is to ask patients for feedback about the student.
All right, Mrs. McKinley, then I'll see you back in a couple of weeks.
Yes, Dr. Jones. See you then.
So I'd like to ask you how the student did. Do you have any suggestions at all for her?
Well, I was kind of mad at the inhaler, but she did a very nice job of explaining how to use it. I think she'll be a very good doctor.
A variation on this is the ask, teach, ask model, known as the new feedback sandwich. First, the student is asked what went well and what was a struggle. Then the preceptor agrees or disagrees and offers brief focused teaching, such as a 1-minute Pearl. Finally, the teacher asks the learner for their plan to improve and even asks for a demonstration of how it could be done better. In this scenario, the preceptor is talking to the student after the preceptor sees the patient back. He asks the student to tell him a little about how the encounter went when he taught the inhaler technique. The student doesn't yet know about how the patient actually used the inhaler.
Good morning, Megan.
Morning.
I'd like to ask you a little bit about how your patient education session went with Mrs. McKinley last week.
Okay.
Well, what went well?
Well, I think I found a good resource for showing her how to use the inhaler. And I think I did well demonstrating how to push down and breathe in and the timing of it all.
What did you struggle with?
Well, I would have liked to have an actual inhaler to use so that I could show her a little better how to use it, because it was a little difficult showing her how to push down and breathe in without it in my hand.
Anything else?
No. Is she doing okay?
Well, I agree that you did a really nice job in showing her how to use the inhaler. One other important aspect is frequency of use. Unfortunately, when you said use as often as needed, she took that to mean every 20 minutes, and she ended up in the emergency room with palpitations. Sometimes it just takes 1 or 2 minutes to have the patient demonstrate back how to use the medicine and how often. And it's also good to talk about the dangers of overuse of beta agonists. So tell me, what could you do to improve?
I would have emphasized using the inhaler no more than 2 puffs every 4 hours.
Good. Now let's pretend I'm the patient, and I want to have you pick up after giving instructions and show me how you'd complete your teaching.
Okay. Well, I would really tell her, it's really important to not overuse this medication.
Students often say they do not get enough feedback from preceptors. Sometimes we are just too busy, but hopefully, using these tools, we can all offer daily feedback to our medical students in just a few minutes' time to help them become the best physicians they can be.